1. A nurse is caring for 4 patients. Which patient should the nurse assess first? 1. A post-op client with a blood pressure of 90/60 millimeter of mercury. 2. A client with a temperature of 100.2 degrees Fahrenheit. 3. A client awaiting discharge teaching. Or 4. A client requesting pain medication. Answer. The nurse should assess the post-op client with a blood pressure of 90/60 mmHg first. Rationale. A post-operative client with hypotension may be experiencing internal bleeding or shock, which is a potentially life-threatening condition that requires immediate attention. 2. A nurse on a medical surgical unit is planning care for the day. Which task should be delegated to the unlicensed assistive personnel UAP? 1. Assessing a pressure ulcer. 2. Administering oral medications. 3. Ambulating a stable post-op client. Or 4. Teaching incentive spirometry use. Answer. The nurse should delegate ambulating a stable post-op client to the UAP. Rationale. UAPs can perform tasks involving stable clients that do not require clinical judgment, such as ambulation. Assessments, medication administration, and teaching are within the RN scope. Point 3. A nurse enters a client's room and finds the client unresponsive with no pulse or respirations. What is the nurse's priority action? Answer. The nurse should immediately begin cardiopulmonary resuscitation CPR. Rationale. The absence of pulse and respirations indicates cardiac arrest. Initiating CPR immediately is critical to maintaining circulation and oxygenation. For a client with chronic obstructive pulmonary disease, COPD, becomes short of breath while ambulating. What is the nurse's best initial action? Answer. The nurse should have the client sit down and rest. Rationale. Resting decreases oxygen demand and allows for recovery of oxygenation in a COPD patient. This is the safest and most immediate intervention. 5. A nurse is assigning tasks on a unit with both RNs and UAPs. Which task should be assigned to the RN? Answer. The RN should perform an admission assessment for a newly admitted patient. Rationale. Admission assessments require critical thinking and clinical judgment, which are within the RN scope of practice. 6. A nurse is caring for a client with diabetes mellitus who has a blood glucose level of 45 milligrams per deciliter. What should the nurse do first? Answer. The nurse should administer a fast-acting carbohydrate. Rationale. Hypoglycemia is a priority emergency. A rapid source of glucose must be given immediately to prevent further decline. 7. A nurse is preparing to delegate tasks to a UAP. Which factor must the nurse consider first? Answer. The UAP's level of competence and training. Rationale. The nurse must ensure that the person being delegated to is competent and trained for the task to ensure patient safety. 8. A nurse notices that a client's oxygen saturation has dropped to 88%. What is the nurse's priority action? Answer. The nurse should apply supplemental oxygen. Rationale. Hypoxia is a critical condition. Applying oxygen is an immediate intervention to restore adequate oxygenation. 9. During change of shift report, which client should the nurse assess first? 1. A client with a potassium level of 6.2 milliequivalent/L. 2. A client reporting nausea. 3. A client who is 1 day post-op. Or 4. A client scheduled for discharge. Answer. The nurse should first assess the client with a potassium level of 6.2 milliequivalent/L. Rationale. A high potassium level can lead to life-threatening cardiac arrhythmias, making it a priority. 10. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial nursing action? Answer. Report the incident to the nurse manager immediately. Rationale. Patient safety and ethical practice require reporting unsafe or illegal behavior through proper channels. 11. A client with heart failure is receiving furosemide. The UAP reports that the client's urine output has been 100 milliliters in the last 6 hours. What is the nurse's best action? Answer: assess the client and notify the healthcare provider. Rationale: decreased urine output may indicate worsening heart failure or dehydration, requiring provider notification. 12. A client with a chest tube becomes increasingly short of breath and tachypneic. What should the nurse do first? Answer: assess the chest tube for patency and function. Rationale: a malfunctioning chest tube can lead to tension pneumothorax. Assessment ensures early intervention. 13. The nurse finds a post-op client disoriented and attempting to get out of bed. What is the best action? Answer: stay with the client and call for assistance. Rationale: patient safety is a priority. Staying with the client prevents falls while help is summoned. 14. A nurse must assign a task to an LPN. Which task is most appropriate? Answer: administering oral medications to stable clients. Rationale: LPNs can safely give medications to stable patients, but complex assessments and 4 pushes are outside their scope. 15. A client with pneumonia has new onset confusion. What is the nurse's first action? Answer: assess oxygen saturation levels. Rationale: hypoxia can cause confusion in older adults. Checking oxygen levels identifies a potentially reversible cause. 16. A client receiving morphine for pain suddenly becomes difficult to arouse. What should the nurse do first? Answer: assess respiratory rate and oxygen saturation. Rationale: morphine can depress respiration. Respiratory assessment is a priority to determine next steps. 17. A nurse must float to a pediatric unit for a shift. Which assignment is most appropriate for the nurse? Answer: caring for a stable adolescent post-appendectomy. Rationale: the floating nurse should be given a stable patient whose care does not require pediatric specialization. 18. A nurse is caring for a client receiving 4 potassium. The client reports burning at the site. What is the best response? Answer: stop the infusion and assess the foresight. Rationale: for potassium is irritating to veins. Burning may indicate infiltration or phlebitis and must be addressed immediately. 19. The UAP tells the nurse that a client's blood pressure is 80/50 mmHg. What is the nurse's best response? Answer: immediately assess the client's vital signs and condition. Rationale: hypotension may indicate shock or internal bleeding, requiring prompt nurse assessment. 20. A nurse caring for 4 clients must leave a unit for a short break. Which client is appropriate to assign to another RN? Answer: a client receiving 4 antibiotics who requires monitoring for side effects. Rationale: an RN is needed for clients receiving 4 medications due to potential adverse reactions and need for assessment. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.